Heart attack and stroke often whisper before they strike, especially in seniors. The key is not waiting for severe chest pain, but acting on the small signals your body sends. Doctors have seen lives saved simply because someone paid attention to these early warning signs. Most seniors still believe a heart attack always begins with severe chest pain, but the truth is much more dangerous. The problem is that nearly 20% of heart attacks are silent, showing no chest pain, no fainting, and no urgent warning signs. These hidden episodes quietly damage the heart muscle, and without treatment, they raise the risk of a second heart attack or even a deadly stroke. Many of the subtle signs are dismissed as normal aging. The solution is awareness and early recognition. By understanding the early warning signs of a heart attack, even the ones that do not look like heart problems, seniors and their families can take action before permanent damage occurs. Unlike a stroke, which happens when a blood vessel in the brain is blocked or bursts, a silent heart attack slowly deprives the heart of oxygen without the person realizing it. And the evidence is undeniable. Doctors have seen countless patients from younger adults to seniors saved simply because their loved ones recognized one small sign that seemed unrelated to the heart. Medical studies confirm that people who catch these symptoms early are far more likely to recover and avoid future complications. 1. Unusual, persistent fatigue. One of the most overlooked symptoms of a heart attack is unexplained fatigue. This is not the kind of tiredness that comes from hard work. It feels like exhaustion or shortness of breath even with very simple activities, walking a few steps, making the bed, or carrying a light bag. Why does this happen? When blood flow to the heart is reduced, the heart cannot pump enough oxygen-rich blood to other organs, especially the muscles, brain, and lungs. The body slips into a mild but constant oxygen shortage, leaving you drained, sleepy, and unmotivated, even after a full night's rest. This symptom is especially common in seniors, particularly women over 60. Because it does not cause pain or panic, many dismiss it as normal aging, stress, or lack of sleep. 2. Mild shortness of breath. If you notice difficulty breathing even while sitting or walking slowly, do not ignore it. When the heart is not working efficiently, blood can back up into the lungs, causing tightness, heaviness in the chest, or a slight cough, especially when lying down. Many people need extra pillows to sleep or wake up at night feeling panicked. This is an early warning sign that the heart is struggling to move blood back from the lungs. 3. Nausea, indigestion, or stomach discomfort. Many people, especially women, experience a heart attack not with chest pain, but with mild nausea, indigestion, feeling full quickly, or heartburn. This happens because nerves connecting the heart and stomach can send mixed signals when blood flow to the heart decreases. The digestive system also receives less blood, reducing its function and causing mild disturbances. These symptoms often look like simple stomach problems, so many take antacids and miss the critical window for heart attack treatment. 4. Cold sweats, dizziness, or lightheadedness. This is the body's response when circulation is disrupted. When the heart cannot pump strongly enough, blood pressure may drop suddenly, leaving you dizzy, lightheaded, or unsteady. Cold sweats are a warning that the sympathetic nervous system is in overdrive, signaling danger. For older adults or those taking blood pressure medication, these symptoms are often mistaken for side effects or just low blood pressure. In reality, they may be an early sign of a heart attack. 5. Unexplained anxiety or a sense of doom. A lesser-known but very common symptom is a feeling of restlessness, nervousness, or an unshakable sense that something is wrong. This is the brain's response to reduced blood flow in the heart, creating a state of mild panic. Many women describe feeling skipped heartbeats, loss of calm, or inner discomfort before a heart attack, only to be told they are too sensitive or just anxious. Because of this, they miss the chance for timely intervention. All of these symptoms may seem subtle, but that is exactly why they are so often underestimated. For seniors, women, and people with conditions like diabetes or high blood pressure, these mild signs can be the most dangerous signals of all. If you feel that something is not right, or notice these symptoms in yourself or a loved one, seek medical care immediately. In both heart attack and stroke, time is life. But that is only part of the story. The symptoms of a heart attack can vary greatly depending on the person, and if you think everyone experiences it the same way, you may be mistaken. Next, I will help you understand the differences between men, women, seniors, and those with underlying health conditions, and a few points may surprise you. One of the main reasons people miss the warning signs of a heart attack is because they believe. It looks the same for everyone. The truth is the complete opposite. The symptoms of heart attack and stroke change significantly depending on gender, age, and existing health problems. This is why understanding the specific patterns for each group can help you and your loved ones avoid being caught off guard. Men. Typical symptoms, but often ignored. In men, especially those in middle age and older, a heart attack often begins with the classic signs: chest pressure or pain radiating to the left arm, cold sweats, and shortness of breath. The danger is that many men tend to downplay these symptoms, thinking it is just shoulder strain, work stress, or a stomach problem. Delaying medical care often means missing the golden window for life-saving treatment. Women. Vague symptoms, easily overlooked. This is the group most at risk for misdiagnosis or delayed diagnosis. Instead of severe chest pain, women often experience non-typical symptoms such as sudden, deep fatigue, indigestion or nausea, upper back pain, or jaw pain, anxiety or palpitations. Mild shortness of breath even without exertion. Many cases of heart attack in women are mistaken for digestive issues, insomnia, or stress. Post-menopausal women are at even greater risk because hormonal changes increase the chance of artery blockage. Seniors. Subtle signs with serious consequences. Among seniors, the group at highest risk for both heart attack and stroke, the symptoms can be very quiet. No sharp pain, no panic. Instead, they may feel unexplained tiredness, shortness of breath, weakness or unsteady walking, dizziness or brief fainting, loss of appetite or mild nausea. The problem is that seniors and even their caregivers often assume these issues are due to age or another illness. In reality, many have already experienced a mini heart attack without knowing it. People with underlying conditions: diabetes, high blood pressure, high cholesterol. Those with diabetes often have nerve damage that reduces pain sensation, so they may not feel typical chest pain even when a coronary artery is severely blocked. This makes them more likely to suffer a silent heart attack. For people with high blood pressure or high cholesterol, the blood vessels are already weakened, so a heart attack can strike more suddenly, more severely, and be harder to control. These individuals must pay close attention to even small changes in their bodies: sudden insomnia, unexplained shortness of breath, poor appetite, or a general sense of feeling off without a clear reason. In summary, there is no single pattern that applies to everyone. Recognizing heart disease requires understanding the unique characteristics of each group, especially those closest to you. If you are caring for elderly parents, if you are a middle-aged woman, or if you live with someone who has diabetes, knowing these specific signs could help you save a life in an emergency. No matter who you are, if you do not respond in time, every symptom becomes meaningless. So, when should you call for emergency help immediately? And in what situation should you never wait, not even for a single minute? I will show you right now. One of the most important factors for surviving a heart attack is response time. That is why doctors often say, time is muscle. With every minute that blood cannot reach the heart, part of the heart muscle suffers permanent damage. So, when should you call for help? First, if you or a loved one has severe chest pain lasting more than 5 minutes, with pressure, squeezing, or burning discomfort. This is one of the clearest heart attack symptoms, especially if it does not improve with rest. Second, sudden shortness of breath, as if you cannot get enough air, or rapid breathing without exertion. If this shortness of breath is combined with fatigue, dizziness, or nausea, do not wait. Third, cold sweats pouring out unexpectedly, or pale skin with cold hands and feet. This shows the nervous system is responding to an internal emergency. Fourth, any feeling of weakness in the limbs, numbness on one side of the body, slurred speech, or drooping face. These are classic warning signs of stroke. Treat them as an emergency. Never wait to see if it goes away. And finally, do not wait until you are certain. Heart attack and stroke do not need certainty to strike, and if you delay until every sign is obvious, it may already be too late. Many people, especially seniors, tend to endure their discomfort or avoid disturbing family, waiting overnight or taking medicine on their own. Sadly, this hesitation often costs them the golden window to save the heart and brain. The key message is simple. Calling for help is always safer than waiting. When in doubt, take action. You will never regret being too careful, but you may regret responding too late. In an emergency, it is not easy to stay calm and remember every symptom. That is why experts recommend simple models to help ordinary people recognize heart attack symptoms and stroke symptoms within seconds. And you do not have to be a doctor to save a life, you just need to remember 4 letters. For stroke, the most effective model is FAST, recommended by the American Stroke Association. F. Face. Is one side of the face drooping? Is the smile uneven? A. Arms. Raise both arms. Does one arm drift down or feel weak? S. Speech. Is the speech slurred or hard to understand? T. Time. If any of these signs appear, call for emergency help immediately. Do not wait. FAST is not only easy to remember, it is also one of the most practical senior health tips because it relies only on observation. No medical tools are needed. For a heart attack, you can remember 3 short words: pain, breath, cold. That means chest pain that lasts, feels heavy, or spreads to the arm. Difficulty breathing or sudden shortness of breath. Cold sweats, chills, or pale skin. Beyond this, trust your instincts. Many people recall having a strong sense that something was terribly wrong, even when they could not describe it. This is not imagination. It is the body sending an urgent signal. For seniors or those with chronic conditions, it helps to keep a simple note listing these warning signs, posted where it is easy to see, on the refrigerator, in the bathroom, or by the bedside. When the moment comes, this small preparation can mean the difference between survival and permanent damage. You already know how to recognize a heart attack and a stroke, but recognition alone is not enough. The bigger question is, what can you do to stop it from happening in the first place? In this final section, I will show you simple daily actions, no medicine, no clinic visits, that can protect your heart for a lifetime. We have walked through all the warning signs of a heart attack, from the obvious symptoms to the silent signals. You now know when to act and how to identify a stroke in just a few seconds. But in the end, prevention is always better than treatment. Remember this. 80% of all heart attacks and strokes can be prevented if you maintain healthy habits starting today. You do not need to change everything overnight. Just begin with small steps, practice daily, and done the right way. First, adjust your diet. Cut back on foods high in saturated fat, refined sugar, salt, and processed items. Replace them with more vegetables, fresh fruits, whole grains, and fatty fish, such as salmon or mackerel. This is the foundation of healthy eating, an essential part of senior health and heart disease prevention. Second, stay active. You do not need a gym or heavy workouts. A 30-minute walk each day, or light activities such as yoga, tai chi, or gentle cycling can improve circulation and strengthen your heart and blood vessels. Third, get enough sleep and manage stress. Short or poor quality sleep increases the risk of high blood pressure and artery damage. Ongoing stress harms the lining of your blood vessels, raising the danger of both heart attack and stroke. Fourth, schedule regular checkups. Do not wait until symptoms appear. A simple blood pressure reading, a cholesterol test, and a blood sugar check can reveal hidden risks and help you take preventive steps early. Finally, pay attention to your body. No one notices small daily changes better than you. If something feels off, trust your instincts and seek advice. Living healthy after 50 is not luck, it is a choice. And you can begin that choice today with the simple steps you just learned in this video. If you found this helpful, share it with your family and friends, especially your parents or the seniors in your life. Sometimes just one person who understands the signs and prevention of heart attack and stroke can save a life. Thank you for staying with me until the end. I look forward to seeing you in the next program, where together we will continue building a healthy, strong, and heart-safe lifestyle. Finally, pay attention to your body. No one notices small daily changes better than you. If something feels off, trust your instincts and seek advice. Living healthy after 50 is not luck, it is a choice, and you can begin that choice today with the simple steps you just learned in this video. If you found this helpful, share it with your family and friends, especially your parents or the seniors in your life. Sometimes just one person who understands the signs and prevention of heart attack and stroke can save a life. Thank you for staying with me until the end. I look forward to seeing you in the next program, where together we will continue building a healthy, strong, and heart-safe lifestyle.